My grandparents and great-grandmother lived together. They lived in a rural area where everything was far away. One day, my great-grandmother Okja fell from bed and broke her pelvis at the age of 98. The ambulance came in and took her to the emergency department, did all the x-rays and tests the hospital could provide for her, but she wasn't able to get surgery because of her age and health issues. Healthcare providers didn't recommend her to get a surgery since she had weak heart and kidney that can put her into a critical condition once the surgery is operated. So she decided to stay at home for the rest of her life without getting surgery. It was hard for Okja because she couldn't do anything by herself without the assistance from my grandparents. Also, it was hard for my grandparents because they weren't at their young ages. Especially whenever Okja had to go to the hospital for regular checkups, my grandparents had to call the ambulance to allow her lay down since she was not able to move or sit straight. Then they had to drive for several hours to get to the hospital. If Okja had access to telehealth, all the costs, inconvenience to transport would make a huge difference. They would not have to travel far ways to get to the hospital, but Okja just can stay at her bed communicating with the physicians and do the simple tests if they were needed. This showed that the telehealth can work for rural areas and also for the elders. During this period of time, telehealth was not well known or used frequently. So when I first heard about telehealth, it made me think, what if my grandparents and great-grandmother knew about telehealth and learned how to use them? This made me want to know more about telehealth. Telehealth is one of the available sources that allows people to communicate, educate, and provide healthcare by using video image and other technological sources. It is a great method to augment on-site clinic visits for many reasons. Telehealth are known to be used in various ways. It can be used as a tool to diagnose a patient who are not able to travel far ways to get to the hospital. Also, it is a great educational tool, such as physical therapists teach their 8-year-old patients who had been born with spina bifida how to use the braces through video conferencing. Also, it can teach the students in healthcare fields. The research showed that the patients and providers are generally satisfied with their experience on telehealth services. It helped the patients to overcome some barriers, including geographic distances. Some studies had similar percentage of patient satisfaction with office assessment and telehealth services. From one study, patients and assisting nurse worked together. Once patient described their symptoms to the assisting nurse and nurse practitioner, the assisting nurse used diagnostic tools designed for telehealth services to show the visual images on the video screen or present the sound through the audio that the providers and patients can hear. Then the practitioner provided prescription electronically or have them printed by the assisting nurse. About 1,800 patients participated. From there, one-third, which is 32% of the participants, expressed a preference for receiving care through telehealth services, and 57% of the participants rated their experience just as good as the traditional visit. The other study provided genetic counseling through on-site clinic and telehealth services. Patients reported overall satisfaction with their experience on telehealth services. This showed that the telehealth can be one of the great alternative methods from on-site clinic. Telehealth is a great tool for the elders. It is cost-effective. Telehealth costs about $40 to $50 per visit, while in-person care costs over $100 per visit. It can reduce costs with travel and provide easier access to the medical care for the elders. Also, it allows greater access to the specialist. Specialists are not always located in every community, so travel might be necessary, which can be difficult for the elders with limited mobility and chronic conditions that delay the movement. Telehealth can remove these barriers and allow the seniors with the care needed provided by the specialist. Nothing replaces face-to-face meeting with family and friends, but there are often times that FaceTime can be a great answer. You don't have to pay for the airplane, transportation, and can save the travel time. Sometimes it is a whole lot faster and convenient to communicate with your loved ones through FaceTime. In my case, I'm only able to see my family once a year or once a semester. If we didn't have FaceTime or calling system, I would have to wait until I go back to my country to physically see them. But for now, as technology had developed a lot, if I want to talk to them, I can FaceTime or call them and talk with them, not worrying about the places and times. The medical care today is exactly like this. Going to the hospital facility cannot be replaced if cares or surgeries are needed. You have to go to the hospital to get your health need taken care of. But sometimes telehealth can be a great answer for simple issues. Telehealth can be accessed wherever you are and allow you to have meetings with physicians for simple problems. Today, if somebody wants to get a hold of you, the message or call comes to you, and that's what exactly telehealth, telemedicine is, which allow people to have easier access to the healthcare services. Telehealth is a helpful tool for the patients and providers. I hope that telehealth can be used more widely throughout the world, so in these ways people like my great-grandmother Okja can have more accessibility to healthcare, which will allow us to take care of the people we love. What are your thoughts toward telehealth services?